Um, if you weren't here a couple minutes ago, um, I am Tamara. I'm one of the social workers on the liver program. So Jenna and I work together. Of course, you all know Jenna. So before we officially get started, I just want to remind everyone that if you are not showing your full name underneath your video, so please either just change it or send a message in the chat or email Jenna so that we can give you proper credit for being here. Second thing is that you're all muted right now, but we'll unmute you at the end if you want to ask questions at that point. But in between now and then, if you have any questions, just put them in the chat box and then we'll address them when we have a chance. And I think that's it. So I will formally introduce David. He is the pharmacist on our team. And David is going to teach us a few things about medication, immunosuppression specifically. So David, the floor is yours.
All right, thank you. All right, so the goal of today's workshop is not necessarily going to be to remember everything that I say about medicines, but instead just introduce a lot of different concepts for medications and things that we can expect after a transplant, if and when that were to occur. So the next slide here is titled, Why Do We Need Medications? And really we need medicines because the body's immune system is there to try and protect us against anything that would be considered foreign. So a couple of examples of that would be things like infection. So bacteria, viruses, and fungus are all types of things that the body's immune system would consider as a foreign object. So the initial thought process would be to try and attack these things. Similarly, cancer is also in that realm as well. The immune system tries to protect us against cancer. But a transplanted organ is treated in the same fashion. So if you have an organ from someone else, your body's immune system will try and attack it. And the body, this response from the body is something that we would call rejection. So the overall goal of trying to use medications after a transplant is going to be to try and prevent rejection, to try and prevent the body's immune system from attacking the new liver. So the transplant medications weaken the immune system to try and to prevent that from happening. And we're going to talk about a lot of those medicines and their side effects as we go throughout the PowerPoint today. I like to break the medicines down into three different categories, or three different slices of pie, if you will. So the first slice here, the first piece, is the anti-rejection medications. And all patients are going to use 3 medications to try and prevent rejection after a liver transplant. And then we're going to talk about medications that can prevent infection. And there'll be also 3 medications to try and prevent infection after a liver transplant. And then there'll be a couple of other medications that you'll need to try and keep you healthy. And we'll kind of mention some of these things as we go along. So the top of the next slide here is anti-rejection medications. So these are going to be, again, the medicines that we use to try and prevent rejection and damage to an organ. Like I mentioned on the previous slide, all patients will start with 3 medications to prevent rejection. And as the risk of rejection decreases, the further and further you get out from the transplant surgery, the doses of the medicines that we use to prevent rejection can also decrease. And eventually, some of the medicines may be discontinued, or we can stop them after a transplant. But the key here is that every patient must stay on at least 1 anti-rejection medication for life. And I'm going to point out which medicine as we go along we consider the forever pill, and that'll be the one that you have to take every day, twice a day for the rest of your life. You may also hear me sometimes throughout this PowerPoint refer to the medicines that prevent rejection as immunosuppression or immunosuppressants. I want you to know that those 3 terms are all one and the same. So the second slice of pie that we're going to talk about is the anti-infection medications. These are going to be there to try and prevent potential infections, since we're lowering the body's immune system. All patients, like I mentioned, are going to start with 3 medications that prevent infection. 1 medicine to prevent viruses, 1 medicine to prevent fungus, and 1 medicine to prevent bacterial infections. And again, as we're lowering the medicines that suppress the immune system, the anti-rejection medications, the risk of infection gets lower and lower. So eventually we can stop the medicines that are preventing infection. In fact, all of the anti-infection medications are stopped by the 1-year mark after the transplant. Now, there are going to be a couple of other medicines that you have to use to try and keep you healthy. So all of the patients after a liver transplant get started on a baby aspirin. We typically use this just for 30 days to try and prevent blood clots from forming right at the site of where we hook up the arteries and veins of the liver. We'll also start you on a couple of different vitamin supplements, so a calcium and vitamin D supplement, as well as a prescription strength multivitamin. We may also use medications to try and prevent heartburn or an upset stomach that may be associated with taking lots of new medications together. Now, some patients may also require a medicine to try and lower either their blood pressure or their blood sugar, or sometimes both. The medications that you were taking before a transplant may or may not be restarted after the transplant. So a couple of common examples, sometimes people will say, well, I take a medicine for my thyroid before the transplant. Is that something that continues after the transplant? And the answer there would be yes. There are some things for medicines where if you have high cholesterol, or if you have a thyroid issue, or if you have diabetes that you're taking before the transplant, we're likely going to need to continue after the transplant as well. And if you have specific questions or examples of this, we can kind of talk about individual examples. So the next section here is going to be the general information and important medication tips. So these are going to be some principles that apply to all of the medications that you would be taking after a transplant. So once we've learned some of the generic facts that apply to all the medicines, then we'll focus in and we'll talk about each medicine individually. So the transplant medications are very important. In fact, they're required to try and keep the newly transplanted organ healthy. They're going to, again, be preventing rejection. And patient education is also very important. So these pre-transplant educational workshops are a great way to try and learn about the things that are going to benefit you after a transplant. And of course, post-transplant, you're going to get a lot of teaching from the transplant pharmacist, which is me. So we usually become pretty good friends when you're here in the hospital, because we're going to spend a lot of time together talking about medicines and things that are going to prepare you to be successful at home. So these are the things that I like everybody to know about each medicine. The name of the medicine, both the brand name and the generic name, the purpose of the medication, so why are you taking the medicine, and how are you supposed to take it? So that includes both the correct dose and the timing for the medicine. Compliance after a transplant is also very important. So we always want you to take the medications exactly as prescribed and never skip or intentionally miss any doses. Always refilling the medications on time and keeping an accurate medication list with you. After the transplant, we can set you up with a specialty pharmacy to try and make sure that you get the medication refills on time each month. But if you do have a pharmacy that you like to use before the transplant, we could always send you back there after the transplant as well. But the key is going to be that we can only use pharmacies that are going to guarantee to get you the medicines on time. If you have a pharmacy that you use right now that frequently says to you, I don't have this in stock and we have to order it, that's a good example of a pharmacy that we shouldn't use after the transplant. One of the most common questions I get is about missed dose instructions. So after the transplant, we have a 4-hour missed dose policy. So if you're supposed to take a dose and you miss the dose by less than 4 hours, you can take the dose. If you miss the dose by more than 4 hours, we want you to skip the dose and take the regularly scheduled dose at the next time period. We never recommend doubling up on doses, and we never recommend taking future doses late. We, of course, want you to call the transplant center and let us know if you have missed a dose. And I have a dosing example here on this next slide that I think will really help cement some of these points. So let's pretend that you take medications at 9 a.m. and 9 p.m., but today you woke up late and the current time is now 11 a.m. So the first question is, do you take this medication at 11 a.m.? It's 2 hours past your normal schedule. I can see some people already nodding. The answer is yes. If you take this medication, it's within the 4-hour window, so you can go ahead and take it. It's been only 2 hours since the scheduled time. The second question here is, well, when do you take your next medication dose? And the answer here is at 9 p.m. We never want you to try and wait up to try and take the future dose, exactly 12 hours apart. We want you to stick to 9 and 9 as closely as possible. And the third question here is it important to call and tell the transplant team? And the answer is yes. After a transplant, we always joke with patients and say that, when you have a transplant here, you're basically married to our center. And the key to any marriage is communication. We want you to give us a call if you have any questions, comments, or concerns, or for things that are happening at home, so that we can best help you to deal with that. The title of this next slide here is called Drug Interactions. So sometimes one medicine can change the way that another medication is working in the body. And the transplant medications that we use can have significant interactions with other medicines. Now, these interactions can cause harm if they're not addressed by the transplant team. So what we need you to do here is always call the transplant team before starting any new medications. So this includes prescription medications, this includes over-the-counter medications, because any types of medicines can have interactions with the regimen that we want to use after the transplant. The other really important thing here is not to take herbal supplements or dietary supplements as a blanket statement, because these things can interact or change the way that some of our rejection medications are working. If you have a particular product or a supplement that you like to take now, at the time of the transplant, we could always talk about it and make sure that it's either safe to take, or if it's not safe to take, that you're not going to do it after the transplant. The other very common question I get after a transplant is, what is safe to take that's an over-the-counter medication for something like if you have a headache or if you have mild pain? And the key here is that acetaminophen or Tylenol is safe to take after the transplant, but the key is that you cannot exceed more than 2,000 milligrams in any 24-hour period. So I have that on the slide. What that means, if you have extra strength Tylenol at home, it's 5 to 500 milligram tablets. You can take 4 tablets in any 24-hour period. If you have the regular strength Tylenol at home, which are 325 milligram tablets, you can take 6 tablets in any 24-hour period. If you had more pain that was not being relieved by this amount of Tylenol, you can easily call the transplant center and we can give you a prescription medication instead to try and treat the pain. Remember that Tylenol comes in lots of different combination products. So sometimes if you buy a cough or cold product that's over the counter, it may also contain Tylenol. So we need to add up the Tylenol from all of the different sources and make sure that we're not exceeding more than 2,000 milligrams in any 24-hour period. This other bullet point down here at the bottom is very important. So no ibuprofen, Motrin, Advil, naproxen, Aleve, Excedrin. All of these medications have a drug interaction with one of the medicines that we want to use to try and prevent rejection. So these are examples of medicines that you cannot take. And the medicine that I'm particularly referring to is one of the forever pills that you're going to be on for the rest of your life. So you cannot take these classes of medications. All right, now there are a couple of food interactions. If you haven't already, you may meet my colleague. Her name is Paige. She's our transplant dietitian, and she'll usually give you a good overview right at the time of the surgery of foods that you are good to eat after a transplant. From a pharmacy perspective, there's just a couple of things that can interact with the medicines that we're going to use. And I have those things listed here on the slide. So you cannot eat or drink grapefruit or pomegranate after the transplant. So that includes the actual fruit, the fruit juice, the extract, the seeds, any of the above. They all have a drug interaction with one of the medicines we want to use. So it's very important to read the ingredient labels of fruity juices and sodas. So for example, things like Sunny Delight, LaCroix, and Fresca all have grapefruit extract in them. So that would be very important to try and avoid those things after the transplant. But all of the other fruits and vegetables, juices are okay. So things like apple juice, orange juice, lemon juice, all of these things would be examples of things that are okay to take after a transplant. But you cannot have grapefruit or pomegranate. One other thing that we have here is a discussion about brand versus generic drugs. So generic products have the exact same ingredient as the brand, and generic drugs are safe to take after a liver transplant. In fact, in the hospital, we'll be using all of the generic drugs here in the hospital. The key is that you be consistent. So we love consistency after a liver transplant. We want you to be consistent on one manufacturer. And basically what that means is if you go to the pharmacy every month and your pills look the same, then that's okay. If you go to the pharmacy 1 month and you come back and your pills look much different than they did the previous month, that's a time where we'd like you to call the transplant center just so we can figure out why it is that you got a different manufacturer. And in some cases, we may need to just check an extra set of blood work. We typically use specialty pharmacies post-transplant that know that we like consistency. And we try and set you up with a pharmacy that's going to give you the same product each time. The next slide here is titled The Transplant Pharmacist. So that's me. After the transplant, everybody's going to receive medication education with me. And in fact, I usually encourage or I require that you have your primary caregiver with you to attend this educational session so that everybody can learn about the medicines together. On the day of discharge, I'll review the medication list with you as well as your family member. And I'm also going to give you a couple of key things that you'll need at home. The first thing that's one of the most important is the medication schedule. So I'll give you a medication list that'll have all of the instructions that you'll need on the list. That'll tell you how to take the medications. It'll have those couple of key points that I mentioned before, the name of the medicine, the reason why you're taking it, and how you're supposed to take it. The key here is that we only want you to follow the medication list for the instructions on how to take the medicines, and never follow the instructions that are written on the bottles of the medicines themselves. It's very important because on the day that somebody gets transplanted, we order all the medications on that day, and they may not go home for somewhere between 7 to 14 days after the transplant. So sometimes the doses of the medicines change so frequently that we prefer you follow the list that we give you and not necessarily the instructions in the bottle. And we always want you to bring an updated copy of your medication list with you to each clinic appointment so that you can take notes on the medication changes, and everybody will be on the same page about what you're taking. Here's an example list of what the medication list might look like after the transplant. So I typically have 3 large columns here. We have a column here that shows you which medicine you're taking, both the brand name and the generic name. In the second grouping of columns, you have the times that I want you to take the medicines as well as the amount. And then in the third column, there's the reason why you're taking the medicine and some helpful tips and tricks about a couple of different medicines that'll be important to remember. And when you get discharged from the hospital, I typically bring with me a 1-month supply of medications. The medication lists a blood pressure machine, a thermometer, a pill cutter, as well as a 7-day pill box that will fill together. So everything that you'll need at home for medicines, I'm going to give you before you leave the hospital. All right, so now let's talk about each different medication one by one. I'll pause here for a couple of seconds and see if anybody has any questions that if you want to type them into the chat box about what we talked about that were general tips and tricks about medicines. All right, I don't see anybody typing frantically, so We'll move on for now, but if you do have a question, just put it in the chat box and I'll stop and answer it. All right, so we were talking about medications in terms of 3 different pieces of the pie. The first piece was the anti-rejection medications. These were the medicines to prevent rejection and damage to the organ. Remember, everybody must stay on at least one medication to prevent rejection for life. And these are the 3 medications that we're going to spend some time talking about now. The first one here is called Tacrolimus or Prograf. The second one is called mycophenolate sodium, or the easier version is Myfortic. And the third one is called Prednisone. So let's start with the first medicine there, Tacrolimus or Prograf. This is the most important medication to try and prevent rejection. This is the one I call the forever pill. Every day, twice a day, for the rest of your life to keep the new liver working correctly. Prograf comes in a couple of different capsule sizes, and I have them listed on the slide here. There's a 0.5 milligram capsule that's yellow. There's a 1 milligram capsule here that's white, and there's a 5 milligram capsule here that's red. Sometimes, depending on your blood work, we may need to give you a dose of Prograf where you'll have to use a couple of different capsule sizes. So for example, on the next slide here, there's a couple of dosing examples. So if someone were to be taking 3 milligrams twice a day of Prograf at 9 a.m. and 9 p.m., that means they'll have to take 3 of the 1 milligram capsules in order to get to that dose. If, for example, we decrease the dose to 2.5 milligrams in the morning, that still means that you have to take 3 capsules, but it would be 2 of the 1 milligram capsules and 1 of the 0.5 milligram capsules. And similarly for the 6 milligram dose, 1 of the 5 milligram capsules and 1 of the 1 milligram capsules in order to make that dose. The dose of Prograf is one thing that changes very frequently after the transplant. And that's very common. It's normal. It happens in everybody. The dose is adjusted based on how much Prograf is floating around in the blood. We refer to this as the Prograf level. So every day that you're here in the hospital, we take some blood work from you and we figure out if the level is too low, we increase the dose. If the level is too high, we decrease the dose. When you're here in the hospital, we do it every day. When you go home and you leave the hospital, we would check the level just once a week in the clinic. And the key here, and I have this on the slide here, is that on the morning of a clinic visit, you can take all the medicines that are due at 9 a.m. except for Prograf. We want you to bring the Prograf with you to clinic. We pull the blood work first, and then you can take the dose right there in the chair. It takes a couple of hours for the Prograf level to come back from the laboratory, but you don't have to wait around for that. You can go home. And what we do is we call you at home and let you know what to do with the nighttime dose of Prograf and all of the other subsequent doses for that week. That's probably one of the most complex points that we'll talk about today. Does anybody have any questions about that process? It's something that we'll reiterate at the time of transplant as well. All right. So let's change gears a little bit and let's talk about the side effects of Prograf. So I have on the top line there's a couple of things listed. So the first one there is the tremor. So sometimes after the transplant, when someone's taking Prograf, if they hold their hand up, their hand may shake a little bit. It's called a tremor. It's not damaging or harmful to the body, but it is annoying. You may see it if you pick up a coffee cup, for example. The good news is that the tremor usually gets better over time. The tremor is related to that Prograf level. So right after the surgery, when we're targeting a little bit higher levels of Prograf because the risk of rejection is highest, that's usually when we see the tremor. Over time, as the risk of rejection gets lower, we can use lower doses of Prograf, and usually this is a side effect that goes away. The other very common side effect for Prograf is a headache about 1 to 2 hours after you take the dose. This is most related with the first couple of doses of Prograf, so it's usually a side effect we see here in the hospital. And we do know that you can take Tylenol or acetaminophen to relieve a headache if you were to experience it. There's a couple of other things listed here like dizziness and confusion, which are typically most common with the first couple of doses while you get it here in the hospital. So that's something that we monitor for while you're here. The other very important thing on the slide is you see the second bullet point there says kidney damage. Prograf can cause harm to the kidneys when used for long periods of time. It's typically not a side effect that we see in a period of days to weeks, but we think about it over a period of months to years down the line. So every time you come to the clinic, we check your kidney function as well, just to make sure that the kidneys are still happy with Prograf. And if we notice over time that the kidneys are not happy with Prograf, we could either lower the dose or potentially switch it to something else. Prograf is the best medication we have to prevent rejection. So we feel that using it, the benefit of using it outweighs this potential risk. Now, there are a couple of other things here, like increases in blood pressure and blood sugar. And we mentioned before that we may need to start other medications to try and treat these things. We're going to come back to this concept in just a couple more slides as well. The second medication here to try and prevent rejection is called mycophenolate mofetil, or Cellcept. Cellcept is the brand name. This is also a medication to try and prevent rejection. It's also taken every day, twice a day, at 9 a.m. and 9 p.m. This one's a little bit easier in the sense that we don't check levels of this medicine, so everybody gets 2 pills in the morning and 2 pills at night. You see this says here, take with food. In fact, all the medicines after a transplant, we want you to eat some food first, and then you can take your medicines right after you eat. We love consistency, so food first and then medicines right after it. The most common side effect for Cellcept is an upset stomach. The easiest way to get rid of this side effect is to take it with food. There are a couple of other side effects of Cellcept. So for example, Cellcept can lower the white blood cell count. White blood cells are cells that help fight off infection. So if we notice that this is happening, we could always hold a couple of doses of Cellcept and allow the counts to recover on their own. The last bullet point there is also very important. So mycophenolate products can cause harm to an unborn baby. So on this next slide here, I have a couple of important points that relate to that. Women of childbearing age must use effective birth control while on mycophenolate and for 6 months after stopping. If you plan on becoming pregnant after a transplant, you have to tell the transplant team before you start trying to have a baby. If you accidentally became pregnant after transplant, you need to notify the transplant team immediately so that we can switch you to something else. This last point is also very important, and it's a little bit more conservative. So the FDA doesn't require that we do this, but we recommend it. Caregivers who are women of childbearing age should wear gloves when handling mycophenolate. Sometimes the capsules come in a very protective coating, and sometimes at the bottom of the bottle, one of the capsules can be broken or split. And we don't want any of the pieces of the capsule or the particles in the bottle to be absorbed through the skin. So we recommend gloves be worn if any of the caregivers are women of childbearing age, so that we don't run into any issues. All right, so we talked about Prograf to prevent rejection. We talked about Cellcept to prevent rejection. The third medication to prevent rejection is called Prednisone. Prednisone is what we call a steroid medication. We use very high doses here at the time of the surgery in the hospital, and then we give you a much lower dose to go home on. Every couple of weeks, we keep decreasing the dose of Prednisone so that at 6 months, you'll be completely off of Prednisone. This is just a medication that you take once a day at 9 a.m. With food, right after you eat some food, and it's to prevent rejection. Now, there are some side effects from using Prednisone. So there's kind of a couple of different things here. Some side effects are related to the high doses that we use here at the time of the surgery in the hospital only. And I have those side effects listed here on the top right-hand side of the slide. So sometimes we see things like mood swings and irritability from using high doses of prednisone right at the time of the surgery to shut off the immune system and allow us to put the new liver in. Some people see things that aren't there. Some people hear things that aren't there. These side effects are most troublesome usually for the caregiver that's at the bedside because they see these things happening in their loved one. The good news is that the liver processes these big doses of steroids pretty quickly. So these are usually only side effects we see in the first 48 to 72 hours after the transplant, and then they go away. Some of the other side effects that are here on the left-hand side of the slide are related to using prednisone over a period of 6 months. So sometimes we see weight gain, so people can have an increase in fluid retention, so sometimes they get swelling in the legs or the feet. Some people feel more hungry from steroids, so they may gain weight through that way. We also mentioned this previously, that prednisone can increase both the blood pressure as well as the blood sugar. So what I usually tell people is this: if you already take something for blood pressure or for blood sugar, it's very likely that we're going to need to continue it after the transplant. We may just have to change the dose a little bit. If you do not take anything for blood pressure or for blood sugar, we have about 50% of patients that may need to start something new to control one of these things. Now, the good news is that prednisone, we decrease the dose slowly over a period of 6 months, and then it stops. So that may not necessarily mean that you have to continue something for either blood sugar or for blood pressure forever. It may stop when the prednisone stops. All right, so we went through a lot of information right there. We had 3 medications to try and prevent rejection. The goal of those 3 medicines is to lower the body's immune system to try and prevent the immune system from attacking the new liver. The goal of the next 3 medications we talk about is going to be to try and prevent infection, because the risk of infection is going to be slightly higher after a transplant. I give you the examples here that we're going to need to use 1 medication to prevent viral infections for 3 months after the transplant. So that would either be Valcyte or Valtrex. We're going to use 1 medication to try and prevent bacterial infections for the first year after the transplant. So that would either be one of the following medicines, Bactrim or Axone. And we need to use 1 medicine to prevent fungal infections after the transplant, typically for somewhere around 6 months. And we'll use either mycostatin or diflucan. So we have 2 options for each of these different things, but based on your blood work, you will only get 1 of the options in each of these categories. So the first medicine we'll talk about is called valganciclovir or Valcyte. This is a medication that's taken 2 tablets just once a day to prevent viral infections, which is most common within the first 3 months after the surgery. Depending on the blood work, you might get either Valcyte or Valtrex. Either way, these medicines are stopped at the 3-month mark. Since they're very similar to each other, they have a similar side effect profile. So the most common side effects that we see are listed here on the slide. Some people get an upset stomach when they take these medicines. And again, we want you to eat some food first and then take the medicines thereafter. We also see some things that we saw on previous slides. For example, these medicines can lower the white blood cell, the red blood cell, or the platelet counts. And of course, if we saw those things happening, these aren't necessarily things that you can feel, but things we pick up in the blood work, and we can hold a couple of doses and allow those counts to recover on their own. So we had 1 medicine to prevent viral infections for 3 months. Next, we're going to talk about getting 1 medicine to try and prevent bacterial infections. And we use this for 1 year after the transplant. So the first thing we'll talk about is B for Bactrim, B for bacteria. Bactrim is a medicine that we use not every day, but on Monday, Wednesday, and Friday morning at 9 a.m. to try and prevent bacterial infections after the transplant. If you're based on your blood work or your allergies, if you didn't get Bactrim, you get this medicine called Dapsone, which is just 1 tablet once a day. But either way, we use a medicine to prevent bacterial infections for 1 year after the transplant. Both Bactrim and Dapsone can cause things like a rash. So what that would mean is you'd see a rash on the arms or on the upper chest. If that were the case, we would want you to call the transplant center so that we could switch you to something else. The other thing that Bactrim and Dapsone do is they can increase your chance of getting sunburn. Now, we care about sunburn after a transplant. Ultimately, what we really care about is skin cancer. So we recommend that you wear SPF 30 sunscreen and you protect any exposed skin from the sun by wearing the SPF 30 sunscreen if you're going to be in the sun for longer than 15 or 20 minutes at a time. Now, it's absolutely freezing right now, but you're going to be on one of these medicines for life, or excuse me, for 1 year. So you need to remember to wear sunscreen. Even if you get transplanted in a winter month, it's still going to be very important in the summer. And finally, we need one medicine to try and prevent fungal infections. So you can receive either mycostatin, which is a mouth rinse that you would use 1 teaspoon in the mouth after breakfast, after lunch, after dinner, and before bedtime, so 4 times per day. Or you could use a medication called diflucan, depending on the blood work, which is just 2 tablets once a day. And we typically use this medicine for somewhere between 1 and 3 months. In terms of the side effect profile of these medicines, the diflucan has a very well-known drug interaction with Prograf. So the reason I bring this up is because when we take you off of diflucan after 3 to 6 months, we may need to just check an extra set of blood work just to make sure that the Prograf levels are okay. The other very important thing is, again, for women of childbearing age, we want you to wear gloves when handling this medication if you're a caregiver helping your loved one who just had a transplant. All right, so we went through a lot of information. Here's a little summary. It's very important to learn your medications and have an accurate medication list with you. It's important to take the medications exactly as prescribed and never skip any doses or miss any doses intentionally. Remember, we do have the 4-hour missed dose policy, just in case you forget to take a dose. We always want you to talk to the transplant team before starting any new medications. And remember that acetaminophen or Tylenol is safe to take after a liver transplant. The key is that we don't want you to exceed more than 2,000 milligrams in any 24-hour period. But all of the other over-the-counter headache and pain medications, ibuprofen, Advil, Motrin, naproxen, Aleve, Excedrin, you cannot take those medications because they have a drug interaction. What kind of questions can I answer for the group today?
Thank you, David. I'm going to.
I just allowed people to unmute themselves. So if you have a question, you should unmute yourself now and you can ask away.